This new tutorial, we're going to have presentation on the gastrointestinal tract examination. So for the gastrointestinal tract examination, we're going to start by examining the oral aspect of the gastrointestinal tract. So examining the oral aspect, you have to examine the lips, you have to examine the angle of the lips, you have to examine the tongue, you have to examine the teeth, and you have to examine the oral mucosa with the pharynx posteriorly. When you're examining, you can see for signs of inflammation on all these aspects. You can see ulcerations, angular cheilitis, or any aphthous ulcer. You can visualize for a change in morphology of the tongue, like in the case of a glossitis, which are treated with different deficiencies. So after examining the oral mucosa, we have also examining the general appearance of the patient, because malnutrition can also be shown on the general appearance of the patient. The next element is now to go to the next aspect, which is the abdominal examination. For the abdominal examination, you have to start by positioning the patient. Now, the first thing is that in an abdominal examination, in an abdominal examination, the patient should completely lie down flat, and then you should flex both knees. As such. Now, when doing abdominal examination, you have to still do the same mnemonics: inspection, palpation, percussion, and auscultation. Please come closer. Now, while inspecting the abdomen, you have to inspect the abdomen on the right side of the patient, inspect the abdomen inferiorly on the foot of the patient, and then inspect the abdomen from the head. All that is to visualize if there is any change in morphology, you have any difference if the abdomen moves with respiration, you visualize if there is any scar on the abdomen. And other aspect, like in obstetrics, you can visualize a hyperpigmented linea nigra, and you can visualize also striae gravidarum. So those are the different aspects that you have to visualize on inspection. Then the next aspect now is palpation. So normally, when you have to do an abdominal examination, the patient should normally have the short completely down until the genitalia should be completely visible. But in this case, you're not going to do that. Now, the next part is palpation. To palpate, we start with superficial palpation. Please, can you tell us if you feel any pain? Superficial palpation, and you palpate with the palps of the finger and not the tips of the finger. Is it painful? You can also look at the face to find if there is any presence of grimace. That is superficial palpation. Similarly, on palpation, you have to find at the level of the different hernial orifices. You have if the umbilical orifice is free, if the femoral orifice is free, if the inguinal orifices are free. Now, the next point is deep palpation. Is it paining? You do deep palpation on each of the different regions of the abdomen. After doing deep palpation, you have to do other elements, like if the case of a patient that has a rebound tenderness, in the case of a patient that has a peritonitis, you have to do rebound tenderness. Press completely and then you relax. If the patient has pain on relaxing, it's going to be a positive rebound tenderness. Now, the next aspect is going to be the palpation of the organs. We are going to palpate the liver, we're going to palpate the spleen, we're going to palpate the kidneys. To palpate the liver, we are going to use the upper aspect of your index finger. You start from the right iliac fossa. Ask the patient to breathe in. Please, can you take a deep breath? Yeah. Can you breathe in? Breathe out. You are trying to, when you breathe out, you go up a bit. Breathe in. Breathe out. When you breathe out, you go up a bit. Breathe in. Breathe out. When you breathe out, you go up a bit. Breathe in. Breathe out. When you breathe out, you go up a bit. Breathe in. Breathe out. So as from here, I'm capable of feeling the inferior pole of the liver. Breathe in. Breathe out. So in order to measure the liver span, I'm going to percuss. This is door until I hear a resonant sound. So here is door, here is door, here is door, but at this position is resonant. So from here to here is going to be the dimension of the liver span. So I'm going to use a measuring tape in order to measure the distance to know the liver span. So from here to here, his liver span is 10 centimeters, and the normal liver span lies between 6 centimeters to 12 centimeters. The next aspect is going to be the palpation of the spleen. In pediatric patient, the spleen grows in the inferior, in the oblique direction, while in adult patient, it grows toward the inferior position. Now, so for adults, you have to palpate from the left iliac fossa. You ask him, can you breathe in, please? Breathe out. I don't feel the inferior pole. Breathe in. Breathe out. I don't feel the inferior pole. Breathe in. Breathe out. I don't feel. Breathe in. Breathe out. So here I feel the inferior pole. The inferior pole is directly located inferior to the left rib cage. So in this case, when it's located inferior to the left rib cage, to classify splenomegaly, we're going to use the Hackett's classification that I'm going to use to give you on the images of the tutorials. After palpation, we have also the palpation of the kidney. To do the palpation of the kidney, we use what is called the balloting. You place one hand inferiorly, and then you place the other hand superiorly, and then you try to press both sides to find if you can feel an organ in between your hands. So in this case, I'm not capable of balloting. Normally, you should not ballot in normal kidneys, only in case of a hydronephrosis or an enlargement of a kidney that you can ballot it. So we'll do it on the other side. So I'm not capable of balloting his kidney. After that, we are now going to move on to the next one, which is percussion. In percussion, you percuss the different regions, and the sound you hear in the abdomen is tympanic sound on percussion. The next element of percussion is to find if there's any percussion tenderness, which is similar to a rebound tenderness. If you percuss, the patient feels pain, it's a percussion tenderness. Now, if somebody has a distended abdomen and you're thinking that there's ascites, you have to do other tests like shifting dullness. So those shifting dullness, you place yourself, you start from the center, that is the umbilicus, you percuss going distally. It's tympanic. 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 But let's say that at this place where I percuss was dull. So what you're supposed to do is to shift the patient towards you such that the fluid descends to the other side of the abdomen. And you wait some minutes. And later on, you because at that same place, if the sound changes from dull to tympanic, it means that it is a positive shifting dullness on ascites. The next one of ascites that's going to help to visualize ascites is going to be for massive ascites in free trill. So for free trill, you ask to place the patient to place the hand. Please, sir, can you place your hand as such? Ask the patient to place the hand as such on the abdomen, and then you palpate the contralateral side while tapping one side. If you feel the vibration on the contralateral side, it's a sign of massive ascites. Now, on the abdomen, we have other specific tests like the swab sign. For the swab sign, please, sir, can you push my hand? Push. This is for a swab sign for acute appendicitis. So he is capable of pushing without having pain at the level of the right iliac fossa. The next one is the obturator sign, where you do internal rotation and then external rotation at the level of the hip to find if there is any pain. So that all those were involved in percussion and palpation of the abdomen. The last one on the abdomen is auscultation. The best place to auscultate the abdomen is at the level of the right iliac fossa on the McBurney point. Now, the McBurney point is located. You palpate at the level of the anterior superior iliac spine. This is a small prominence inferiorly here. And then you palpate at the level of umbilicus. You draw a straight line from the anterior superior iliac spine to the umbilicus, and then 1/3 the distance from the anterior superior iliac spine and 2/3 from the umbilicus is going to be the location of the McBurney point. And that is the best place to hear the auscultation, because at that place is the ileocecal valve where the breaths are going to be best heard. And now, similarly, at this place, you're supposed to have 5 to 10 bowel sounds per minute in a normal adult person and 10 to 30 bowel sounds per minute in a child. So from here we can say, thanks for your kind attention for this tutorial.